A warm evening to one and all present here. Just to appraise you all, I represent a medical college and hospital which is located in a very remote, rural and tribal area of eastern Gujarat. The adjoining two states are Madhya Pradesh, which is around 30 kilometers, and Rajasthan, which is around 70 kilometers. I have a drainage from both these states, and in the periphery of 150 kilometers, we are the only tertiary care hospital in that locality. And please believe me, still we cater to the patients who doesn't have a proper clothing also on their bodies. Like this, the terrains are there, we get patients from all there, and this Zydus Medical College and Hospital is a part of Zydus Foundation, our parent body. Zydus Cadila, the pharmaceutical company, probably all of you must have heard of. And we have got 30 units, various manufacturing units in the pharma industry. We have got two medical college. One is in Ahmedabad proper, that goes by the name of GCS Medical College. And ours is the second one, which is totally owned by our Honorable Chairman, Sri Pankaj R. Patel, sir. Ours is not only the hospital, we are in medical education also. We have got 200 MBBS admission per year. And my hospital is 1,034 bedded hospital, which is, as Dr. Madan Gopal sir was mentioning, it will be a live example. I have got a video also just to share with you all, and I'll share that when we took over this hospital in 2017, when it was only a district hospital with 156 beds. To establish a medical college, we require minimum 300 beds and certain emergency beds to begin with. We fulfilled that criteria. In 2018, we got the permission to start a medical college and hospital. Our main thirst was to establishment of the medical of the hospital, because the country leadership, Honorable Sri Narendra Modi sir, our PM, he had spent a lot of years during his youth in this particular area, especially during the emergency time. And he has seen the way people, they were suffering because of lack of the medical services there. Still now, we are thriving hard to bring down the maternal mortality rate, the infant mortality rate, this area being endemic for sickle cell anemia. So there are a lot of emergencies what we get. Just to give a few statistics, and then we'll go with because already on this topic, Madan Gopal sir has dealt in a very detail, and if I tell, it will be a repetition of the same thing. So we have a footfall of around 2,000 to 2,200 patients per day, our OPD footfall. Around 850 to 900 IPD patients are there in my hospital. Every day we do around 50 to 60 surgeries. Our monthly, the delivery conducted is around 500 plus 550, the range of 500 to 550. And ladies and gentlemen, all our services are free of cost. Pertaining to this, the development of the sustainability technology, we have started doing all the minor things what we required, and really it has got an impact on our hospital finances, and we have curtailed down many of our expenditures. So already this was discussed that our good friend from Netherlands also, they mentioned, generally when we think we are not emitting any carbon emission, but yes, we are. It is not only that we are treating the patients, while in this journey of treating the patients or taking care of the patient, simultaneously we are also generating the carbon footprints or the carbon emission. So the healthcare is already responsible for 4 to 5% of the global carbon emission, and it is said that it is more than the entire aviation industry of the globe. This was shocking to me when I see the statistics, but this is a reality which I wanted to share with you all. यार ये So regarding the sustainable healthcare, it is said that at its core, sustainable healthcare is about creating health system that minimizes their environmental impact while ensuring the care is accessible and affordable to all. भाई ये हो नहीं रहा यार. They say the sustainable healthcare, there are many aspects, but there are mainly 4 major aspects which will be touched upon. The first one being the environmental sustainability, wherein the green infrastructure, the hospital buildings are of the green infrastructure, having the solar panels and the green roofs, energy efficient equipments, as it was mentioned by the previous other speakers. So I'll just go through this slide. I'll request to just play the video, please.
This is Dahod, the easternmost point of Gujarat, a tribal district with a population of just over 28 lakh people, bound by Panchmahal district, Chota Udaipur district, Jhabua and Alirajpur district of Madhya Pradesh, and Banswara of Rajasthan. For decades, this district was lagging behind in the key development parameters. It was ranked amongst 250 most backward districts of India in 2006. Today, Dahod is on the path of growth and progress, scoring on all development parameters, the most important being health. In 2016, Dahod was included in the list of 112 aspirational districts by Niti Aayog. Our Honorable Prime Minister, Shri Narendra Modi ji's vision of inclusive growth led to fast-track development of this remote tribal area. The civil hospital of Dahod was taken over by the Zydus Group in 2017 to improve the healthcare infrastructure. The Zydus Foundation, which has been powering change and transformation through health, education, research and innovation, and community development programs, is inspired by the vision of its chairman, Mr. Pankaj R. Patel.
We at Zydus have always believed in giving back to society and, more importantly, to do this in a meaningful way that creates long-term sustainable impact. Health of the nation is the most precious asset. This can happen only if people living in the community across the country, including the remote areas, have access to good health facility. If people are not healthy, it will reflect on the prosperity and happiness of the nation as a whole. We got an opportunity to make a difference in the lives of patients at Dahod and nearby tribal districts. As we said, let us offer them the same facility and infrastructure that one can get in the city. Now these patients can get excellent medical treatment at their doorstep, free of cost, at Zydus Hospital, Dahod. A new generation of doctors are being trained at the Zydus Medical College, the district's first medical college. This is the beginning of a change and transformation that will have positive impact on health landscape. We are happy to contribute to our Honorable Prime Minister's Shri Narendra Modi ji's vision of Ayushman Bharat.
And so began the transformation journey at Dahod with Zydus Medical College and Hospital, ZMCH. In 2018, the district's first medical college, Zydus Medical College was started. In less than 3 years, a new state-of-the-art hospital infrastructure came into being in the heart of Dahod. Today, this multi-speciality hospital serves more than 38 lakh residents, over 2,885 villagers spread across the 5 districts of eastern Gujarat and also adjoining districts of Madhya Pradesh and Rajasthan.
हमारे यहाँ का हॉस्पिटल का जो पर डे का फुटफॉल है 2200 से 2500 पेशेंट हमारे यहाँ पर डे ओपीडी में आते हैं। एक 750 to 800 पेशेंट्स इन पेशेंट्स में आईपीडी में कभी भी रहते हैं हमारे यहाँ पे। और अब तो ग्रेजुअली पेशेंट इंदौर या काफ़ी दूर दूर से भी पेशेंट्स आने लग गए हैं। तो कोविड के समय में जो हमारा नेशनल का जो रिकवरी रेट था, सिमिलरली वो रिकवरी रेट हमारे यहाँ पे भी था। जिस तरह की ये सुविधा है, ऐसे रूरल और ट्राइबल एरिया में हम लोगों ने ये टर्शरी केयर फैसिलिटीज़ इस्टेब्लिश किया है एंड मंथ ऑन बेसिस एंड यू कैन से ईयर ऑन ईयर बेसिस हम लोग अपने हेल्थ केयर सर्विसेज को स्ट्रेंथन करते जा रहे हैं। इन बिटवीन न्यूरो सर्जरी हमारे यहाँ पे नहीं था, तो हम लोग इस पेशेंट्स को यहाँ से या तो अहमदाबाद या बड़ौदा भेजते थे, लेकिन जो गोल्डन आवर निकल जाने पे इस पर क्या है काफ़ी मोर्टेलिटी होती थी। अब तक हम लोगों ने मोर देन 300 केसेस ऑपरेट कर चुके हैं। मतलब दिस अ काइंड ऑफ क्लिनिकल वर्कलोड वी हैव गॉट इन आवर हॉस्पिटल।
With over 1,000 beds, Zydus Hospital has a staff of over 350 doctors, nearly 500 nurses, besides non-teaching staff of 125 and contractual staff of 500. What is truly to be lauded is that all treatments and services provided at the hospital are free of cost. Today, Dahod serves as a critical healthcare hub for not just Gujarat, but the neighboring states of Madhya Pradesh and Rajasthan. The numbers speak for themselves. In the heart of rural India, it is unimaginable to think of a hospital offering advanced medical care and treatment as any multi-speciality hospital in an urban center would. But that is exactly what ZMCH has been doing with aplomb. Overcrowded ICU facilities and shortage of beds is now a thing of the past. Zydus Hospital has excellent facilities that include ICU, ICCU, SICU, NICU, PICU, RICU, and obstetric ICU to deal with critically ill patients. The vision for excellence was unwavering when the new facilities were being designed. Today's Zydus Hospital has the most comprehensive infrastructure for patients of all ages. The hospital also houses the District Early Intervention Center, DEIC, and supports the children in a holistic way, addressing their defects, diseases, deficiencies, or disabilities and providing necessary care to them. Over the last 1 year alone, 306 malnourished children have been rehabilitated.
So this is a kind of workload or the activities what we are doing in this rural and tribal area. And there is a small team is there, but we are totally dedicated, devoted, and taking care of all the national programs. All the national programs have been conducted in my hospital, and we are trying to, of course, there is a, statistically it has been proved, they have noted in that the infant mortality rate, the maternal mortality rate, the malnutrition, all these things have come down after the existence of. We are a budding medical college and a budding hospital, but the kind of people we are catering to is really, the numbers are, as I said, number speaks of themselves. Thank you so much for your patient hearing. Thank you.
Applause for Dr. Sanjay Kumar. An excellent presentation on sustainable healthcare ecosystem with emerging technologies.